Hello everyone, my name is Professor Anna Harris, and today I'm going to be talking to you about things that might impact INR levels for patients who are on warfarin. There are some things like diet, exercise, illness, medications that patients really need to be aware of because changes in these things might impact their INR levels, and then we as nurses need to be able to determine based on any changes in their INR levels if they need a different dose of the warfarin. All right, so the first thing that we're going to talk about is vitamin K rich foods and drinks. So these are things that might decrease a patient's INR. Vitamin K is essentially the opposite of warfarin. So vitamin K, it can be used in an IV to quickly reverse warfarin. And so patients who eat a bunch of vitamin K foods might find that they have lower INRs. Things that are really high in vitamin K are spinach, kale, broccoli, Brussels sprouts, collard greens, cabbage, to name a few. There are many of those green vegetables that you might think of, like cucumbers and asparagus and green beans, that kind of fall into the moderate category. So the ones listed there are the ones that are really high in vitamin K. Green tea is another option that is high in vitamin K. At our clinic, oftentimes if we need to get a patient's INR lower for their procedure, if they're running just a little bit too high, then we'll actually prescribe green tea. We'll give patients green tea because it is so high in vitamin K, and it will help in bringing down their INR to prepare them for a procedure. Protein shakes like Ensure or Boost also can be high in vitamin K content, so it's important that patients are aware that if they start drinking those on a really regular basis, they might need to have a different dose of the warfarin to compensate for that. So the big thing with vitamin K foods, though, is that the patients don't need to stop eating or drinking these kind of things. Basically, they just need to be aware what is high in vitamin K and remain consistent with their diet and the amount of vitamin K foods that they eat. So if someone loves their broccoli, they really like to have it 3 times a week, no problem. Try to just have the patient stick with that same regimen. Do broccoli 3 times a week or some other source of high vitamin K foods. And then that way, the dose of the warfarin can be based on that amount of vitamin K that's in their diet. It's really going to be those big changes if someone starts, let's say, a green smoothie routine where they're doing veggies in their smoothies every morning. Well, that's definitely going to impact their INR level, and it's important that they tell their anticoagulation clinic or their provider so that their INRs can be checked more frequently right when they start that. Same as those patients who are not on vitamin K foods at all, that's fine for them too. The biggest thing for them is that they'll just want to try to stay consistent with that as well. So again, vitamin K rich foods and drinks, they will decrease the INR. All right, so alcohol. So alcohol in and of itself is a blood thinner. So if you have alcohol and then you put warfarin, another blood thinner on top of it, it can put you at risk for increased bleeding and increased INRs. Therefore, the recommendation really with alcohol is to limit the amount that you drink, no more than 1 to 2 drinks in a sitting. That being said, there are patients who like to have their glass of wine every evening, and you can find a dose of warfarin that kind of works with that as well. The real concern with alcohol is when someone does binge drinking, so that they drink a lot of alcohol in one setting. As you can imagine, they're at really high risk for bleeding complications at that point. So we want to discourage patients from having a lot of alcohol at once and to really drink in moderation. Again, just a couple drinks at a time, if that. And of course, best practice would be to limit all intake of alcohol when you're on a blood thinner. So again, alcohol can increase a patient's INR. So this is a couple foods to remember. They are very random, but they both can have an impact on INR levels. So cranberries is one of them, and then black licorice is the other. So these we tend to find when patients have really high INRs and we just don't know why. If we ask if they've had a bunch of cranberries or black licorice, sometimes that actually comes up as a culprit. So it's just things to keep in mind. Again, on a very minimal occasional basis, this is not going to be a huge concern for patients' INRs, but large amounts, large quantities of them on a regular basis would mean that they might need a different dose of the warfarin to compensate for that. So again, cranberries and black licorice can increase INR levels. All right, so illness. There are a lot of different illnesses out there, of course. Vomiting and diarrhea are one of them, and that can really impact INR levels because diet is normally not consistent during that time. Often any green intake might be gone if someone's not able to take solids or even liquids. Pain, we'll talk a little bit more about stress on the body, but pain can absolutely have an impact on INR levels. Respiratory illnesses, and any illness lasting longer than 3 days is really the recommendation for what we would like patients to tell their providers or their anticoagulation clinic about. So any illness lasting longer than 3 days, it's important to get an INR checked because at that point, the INR could be up, it could be down. It really just depends on what's going on with the person's body and their metabolism. One of the other big things with illness is that patients tend to be taking over-the-counter medications, or they may even be on new medications like antibiotics or steroids, which we know will impact INR levels, and we'll talk about that later too. So again, patients just should be aware to let their providers or their anticoagulation clinic know about illnesses that they're on, especially those that are lasting longer than 3 days and those that are really impacting somebody's oral intake as well as their activity levels. So again, illness can increase and decrease INR. It has variable reactions. Exercise. So exercise and warfarin, the link is essentially in metabolism. So metabolism can affect the rate at which the warfarin is absorbed and excreted from the body. So generally people who start exercising more and more will have increased metabolism, and so that might impact the amount of warfarin that's actually in their system at one time. So general rule, increased exercise leads to increased metabolism, and then that can lead to decreased INR. So generally, you just want to let patients know if they're starting a new workout routine, or vice versa, if they've been doing a workout routine and now they've stopped. You'll notice a lot of times patients who are newly recovering from surgery, as they start becoming more active and their metabolism starts kicking in more, they might need kind of more frequent INR checks to figure out what dose of the warfarin is going to work for them as they start to feel better. Stress. So stress can very strongly impact INR levels. It does affect the rate of metabolism, which can affect the amount of warfarin in the body as well. Typically, with both emotional stress, physical stress like pain, we tend to see higher INRs. Stress can often lower metabolism, meaning that there's more warfarin in a person's system at any given time, which would mean a higher INR. That being said, though, stress can have other reactions on the body as well. So in general, we'd say that stress, while it mostly tends to increase INR, there are cases where it can decrease the INR as well. And then the big category of medications. So there's a long list here. There's even more that aren't listed. But some of the big ones that we know will increase INR are antibiotics and steroids. We strongly encourage patients to let their provider know as soon as they start an antibiotic or a steroid so that INRs can be checked quite frequently while they are on those medications to make sure that the dose of warfarin is not too much for them. The category of medication, the NSAIDs, the non-steroidal anti-inflammatory drugs. So that's like your ibuprofen or your Aleve. Those in general as a category of medications can put you at risk for bleeding, especially intestinal bleeding. And so with warfarin, they are not recommended because of the increase for bleeding risk. So if there's something that you need to take or your patient needs to take for a headache or for pain or for a fever or something like that, Tylenol is actually the medication that's recommended because it doesn't have that increased bleed risk with it. Tylenol on a very infrequent basis, like once a week for a headache, really shouldn't impact your INR levels or a patient's INR levels at all. But if Tylenol is taken very frequently, because it is metabolized through the liver, as is the warfarin, excessive doses of Tylenol or on a very regular basis may impact INR levels because warfarin isn't excreted as quickly or metabolized as quickly in the body, and so it can lead to higher INR levels. So in general, it's important to educate your patients that if they're starting to take Tylenol on a regular basis, to let their anti-coag clinic know. Over-the-counter medications, they can have varied effects. The majority, I would say, are going to increase INRs, but it really does depend. So it's important for patients to always keep their providers updated on new over-the-counter medications as well. And herbal supplements fall into that category as well. So every time you see your patient and you're checking their INR, you want to be asking them if they've had any changes in any of their medications, including these over-the-counter medications or herbal supplements. Multivitamins are also on this list, mainly because they might have vitamin K in them. And so stopping or starting a multivitamin that has vitamin K can mean that the dose of warfarin will need to be changed based on that. So patients should just be aware to notify their provider if they do make those changes. So again, medications, it all varies. They can increase the INR, they can decrease the INR, and so you just want patients to always be in contact with their providers and their anticoagulation clinic to let them know about these changes. All right, guys. So the biggest thing that I hope that you get from this lesson is that consistency is going to be the biggest key for a lot of these things, especially with vitamin K foods, trying to stay as consistent as possible. Same with alcohol intake. Consistency is good, but it does need to be very moderate with alcohol because of the increased bleed risk. With everything else, it's just important to have the patients be aware that they need to be letting their providers, their anticoagulation clinic, know everything that's going on. Being in constant communication is a good thing with this medication because it can help prevent the complications that can come with it. All right, thanks.